You know, our great weekend family doctor, Dr. Michael Breen, shares our philosophy that here on the show we give you information so that you can make intelligent decisions. And that sort of information is especially important when it comes to your health. Mike?
Well, in this weekend's health news, a new drug that can prevent breast cancer is one step closer to being used by millions of women. Now, the drug is a pill called Tamoxifen. Tamoxifen is used to treat women who already have breast cancer. Now, researchers at the University of Wisconsin have shown it's 100% effective at preventing that disease. Within 2 years, Tamoxifen could be used by millions of young women with a strong family history of breast cancer. If you're a man worried about losing his hair, you may soon have nothing to worry about. That's because of new research with the drug Minoxidil. The lotion causes about 40% of men to grow new hair. However, in men with thinning hair, Minoxidil appears to be 100% effective at preventing further hair loss. And the prescription lotion should be approved by the FDA in the next 6 months. The day you walk down the aisle, you may also be helping yourself beat cancer. A new study showed married people with cancer lived 23% longer than single people with the same illness. Now, the reasons: the patient's spouses forced them to get diagnosed earlier and made sure they followed their treatments. What's more, the support from a family actually appears to strengthen a patient's immune system. You don't have to be an athlete to protect yourself from heart disease. A new study shows you can get that protection even if your idea of working out is simply working around the house. Most people think this is the kind of sweat and hard work it takes to prevent heart disease. Yet studies show that only 5% of the men at risk for heart disease actually work out on a regular basis. But maybe you're one of the other 95%. You're not an athlete, but you are active. You take walks, fix up the house, work in the yard. Are those other less strenuous activities also protecting you from heart disease? A new study says yes. That study involved 12,000 middle-aged men. The men were asked how much time every day they spent on leisure activities. Activities like chores around the house, or walking, or bowling. Researchers found the men who did these things for 45 minutes a day were 1/3 less likely to die of heart disease.
Less intense activity, if done frequently enough and on a regular basis, would reduce your chances of dying of a heart attack.
But why should that moderate activity have such a dramatic effect on your heart? Researchers have shown that even leisure activity helps condition your heart. It lowers both your heart rate and your blood pressure. Those are results that should put to rest a common misconception. Now, Dale, Bob, that misconception is that you have to do hard exercise on a regular basis to get any real protection from heart disease.
Dr. Breen, I have a selfish reason for asking this. I work out a lot. I run about 5 miles a day. Does the risk of heart disease decrease even further if you do exercise vigorously?
You know, a lot of people assume that. A lot of people assume if they do an hour's hard exercise every week, 20 minutes 3 times a week, they'll be even more protected than moderate exercise. But that has never really been proven. We assume that based on laboratory studies where we exercise animals, and we find animals who get hard exercise, their heart vessels actually become wider and they get better blood distribution to each of the cells in their heart. But contrary to popular belief, that has never been proven.
Well, I like it anyway. I think I'll keep it up.
Because I exercise a lot too. I think it's a great thing. I feel a lot better.
Great. Thank you, Mike.
Looks good on you, too.